Head, neck, ear, and eye assessment.
Good morning, ma'am.
Good morning po.
Can you state your name po?
My name is Kelly Junisho.
Kailan po yung birthday niyo?
September 20, 2002 po.
Thank you, ma'am. So, today I will be assessing your skull, scalp, and your face po. Is that okay?
Okay po.
In order to do that, I will be needing your cooperation para po maging accurate po yung mga assessment natin for today.
First, assist the client to a sitting position. Inspect the skull for size, shape, and symmetry. Identify the prominences, frontal, parietal, and occipital, that determine the shape and symmetry of the head. The head is rounded, normocephalic, and symmetrical. Palpate the skull for nodules or masses and depressions. The head is normally hard and smooth without lesions. No nodules and depressions when palpated. Palpate all parts of the head by circular motion and use the other hand for support for the head. Inspect the scalp for general color and condition. Inspect and palpate the scalp for cleanliness and lesions. Note for the presence of infections or infestations, pediculosis, and dandruff. And then inspect the facial features. Inspect for symmetry, movement, expression, and skin condition. The eyes, ears, nose, and mouth should be symmetrically placed. The nasolabial fold should be equal. The palpebral fissure should be equal. The top of the ear should be equal to the canthi of the eyes. Note symmetry of facial movements.
Ma'am, can you smile po? Can you frown po? So, ma'am, check ko natin.
Palpate the temporomandibular joint.
Can you open your mouth po? Close. Open.
There is no swelling, tenderness, or crepitation with movement. Mouth opens and closes fully 3 to 6 cm between upper and lower teeth. Lower jaw moves laterally 1 to 2 cm in each direction.
Ma'am.
And then document findings in the client record. Assessment of the neck. Inspect the neck muscles, sternocleidomastoid and trapezius for abnormal swelling or masses. Neck are equal, symmetric with head centered without bulging masses. Observe movement of the neck structures. Ask the client to swallow a small sip of water. Observe the movement of the thyroid cartilage and thyroid gland. The thyroid cartilage, cricoid cartilage, and thyroid gland move upward symmetrically as the client swallows. Inspect range of motion. Ask the client to turn the head to the right and to the left, chin to shoulder, touch each ear to the shoulder, touch chin to chest, and lift the chin to the ceiling.
Your ears po to shoulder. And then yung chin nyo po sa chest. Yung sa ceiling po yung chest.
There should be coordinated, smooth head movement with no discomfort. Palpate the entire neck for enlarged lymph nodes. So the first is preauricular or in front of the ear, and then the occipital at the base of the skull, post-auricular or behind the ear, submental or behind the tip of the mandible at the midline, submandibular, superficial cervical, deep cervical, and supraclavicular or above the clavicle. And lymph nodes are not palpable. And then palpate the trachea for lateral deviation. First, place your finger on the sternal notch. Feel each side of the notch and palpate the tracheal rings. The first upper ring above the smooth tracheal rings is the cricoid cartilage, and the trachea is placed in the midline of the neck. Then inspect the thyroid gland. The thyroid gland is not visible on inspection, and the glands ascend during swallowing but are not visible. Palpate the thyroid gland for smoothness. Stand in front or behind the client and ask the client to lower the chin slightly. It relaxes the neck muscles. Place your hands around the client's neck with your fingertips on the lower half of the neck over the trachea. To examine right thyroid lobe, have the client lower the chin slightly and turn the head slightly to the right. With your left fingers, displace the trachea slightly to the right. With your right fingers, palpate the right thyroid lobe. Have the client swallow while you are palpating. Then repeat the process on the other side. And then document findings in the client record. Assessment of the eye structure and visual acuity. Inspect the eyebrows for hair distribution, alignment, skin quality, and movement. Hair is evenly distributed. The client's eyebrows are symmetrically aligned and showed equal movement when asked to raise and lower eyebrows.
Can you raise your eyebrows po? And then lower.
Inspect eyelashes for evenness of distribution and direction of curl. Eyelashes must appear to be equally distributed and curled slightly outward. Inspect the eyelids for surface characteristics, ability to blink, and frequency of blinking. First, invert the upper eyelid. Ask the client to look down with her eyes slightly open. Gently grasp the client's upper eyelashes and pull the lid downward. Place a cotton tip applicator approximately 1 cm above the eyelid margin and push down with the applicator while still holding the eyelashes. Hold the eyelashes against the upper ridge of the bony orbit just below the eyebrow to maintain the everted position of the eyelid. Examine the palpebral conjunctiva for swelling, foreign bodies, or trauma. Return the eyelid to normal by moving the lashes forward and asking the client to look up and blink. The eyelid should return to normal. Then repeat the procedures to the right eye. Inspect the bulbar conjunctiva for color, texture, and the presence of lesions. It must be transparent with few capillaries evident. Sclera is white.
Okay po. Tingin po kayo sa kaliwa. Move your eyes. Tapos sa kanan. Pataas po.
Inspect the palpebral conjunctiva. Inspect the palpebral conjunctiva of the lower eyelid by placing your thumb bilaterally at the level of the lower bony orbital rim and gently pulling down to expose the palpebral conjunctiva. Avoid pressuring the eye. Ask the client to look up as you observe the exposed area. The palpebral conjunctiva appeared shiny, smooth, and pink. Inspect and palpate the lacriminal gland, lacriminal sac, and duct. Use one finger and palpate just inside the lower orbital rim to assess the nasolacriminal gland for blockage. There is no edema or tearing of the lacriminal gland. No drainage should be noted from the puncta when palpating the nasolacriminal gland. Inspect the cornea for clarity and texture. Cornea is transparent, smooth, and shiny, and the details of the iris are visible. Perform the corneal sensitivity reflex test. The client blinks when the cornea is touched.
Look straight.
Inspect the pupils for color, shape, and symmetry of size. The pupils of the eyes are black and equal in size, normally in 3 to 7 mm in diameter, round, smooth border, iris flat and round. Assess each pupil's direct and consensual reaction to light. Partially darken the room. Ask the client to look straight ahead using a pen light or flashlight and approaching from the side. Shine a light on the pupil. Observe the response of the illuminated pupil. It should constrict. It is also known as direct response. Shine light on the pupil again and observe the response of the other pupil. It should also constrict or consensual response. Assess each pupil's reaction to accommodation. Hold an object about 10 cm from the bridge of the client's nose.
Tingin ka dito. Tapos tapos mo yung tingin mo.
Observe the pupil response. The pupil should constrict when looking at the near object and dilate when looking at the far object. Move the pen light or pencil towards the client's nose. The pupils should converge. Perla. Illuminated and non-illuminated pupils constricts. Pupils converge when object is moved towards the nose. Assess peripheral visual fields or confrontation testing. Have the client sit directly facing you at a distance of 60 to 90 cm.
Ma'am, can you close your eyes tapos cover you? Tapos, tingin lang po kayo sa ilong. Tapos, kapag nakita niyo na po to sa peripheral view niyo po, sabihin niyo po yes.
To test the temporal field of the left eye, extend and move your right arm in from the client's right periphery. Temporally, peripheral objects can be seen at right angles to the central point of vision. To test the nasolabial field of the left eye, extend and move your left arm in from the periphery. The nasal field of vision is normally 50 degrees away from the central point of vision because the nose is in the way. To test the downward field of the left eye, extend and move the right arm up from the lower periphery. The downward field of vision is normally 70 degrees because of the cheekbone is in the way. To test the upward field of the left eye, extend and move the right arm down from the upward periphery. The upward field of vision is normally 50 degrees because the orbital ridge is in the way. Then repeat the steps for the right eye, reversing the process. Assess 6 ocular movements. Stand directly in front of the client and hold the pen light at a comfortable distance, such as 1 feet in front of the client's eyes. Ask the client to hold the head in a fixed position facing you and to follow the movements of the pen light with the eyes only. Move the pen light in a slow, orderly manner through the 6 cardinal fields of gaze, that is, from the center of the eye along the lines of the arrows and back to the center. Stop the movement of the pen light periodically so that nystagmus can be detected. When testing for the extraocular muscle, both eyes of the client coordinately move in unison with parallel alignment. Assess the near vision. Assess near vision by providing adequate lighting and asking the client to read from a magazine or newspaper held at a distance of 36 cm.
I'm writing this letter to let you know that last October
The client should be able to read the newsprint held at the distance of 14 inches. Assess distance vision. Ask the client to stand or sit 20 feet from the Snellen chart.
Ma'am, cover niyo po yung left eye niyo. Okay. And then, basahin niyo po yung letter na
Take 3
tinuturo ko.
readings, right eye, left eye, or both eyes. Record the readings of each eye and both eyes, the smallest line from which the person is able to read one half or more of the letters.
P, E, C, F, D, E, D, F, C, Z, P.
And then yung right eye po.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, T, O, D, P, C, T.
Okay.
Normal vision based on the Snellen chart is 20/20. At a distance of 20 feet, the normal eye can read the chart. Document findings in the client record. Assessment of the ears and hearing. Inspect the auricles for color, symmetry of size, and position. Palpate the auricles for texture, elasticity, and areas of tenderness. Auricles are symmetrical and have same color with her facial skin. It is also aligned with the outer canthus of the eye. Its texture are mobile, firm, and not tender. The pinna recoils when folded. Using an otoscope, inspect the external ear canal for cerumen, skin lesions, pus, and blood.
Ay, ma'am, check lang natin.
Observe the color and consistency of the ear canal walls and inspect the character of anal nodules. A small amount of odorless cerumen is the only discharge normally present. Inspect the tympanic membrane for color, shape, and gloss. The tympanic membrane should be pearly, gray, shiny, and translucent with no bulging or retraction. It is slightly concave, smooth, and intact. Assess client's response to normal voice tone. Normal voice tones are audible.
Okay ma'am. Kamusta naman po yung pakiramdam mo?
Okay naman po. Wala naman po ako ibang nafe-feel na hindi po maganda.
And then perform the watch tick test. Have the client occlude one ear. Out of the client's sight, place a ticking watch 2 to 3 cm from the unoccluded ear. Ask what the client can hear and repeat with the other ear.
Ano po naririnig nyo?
Yung pag-tick po ng watch.
Ano po naririnig nyo ma'am?
Yung pag-tick pa rin po ng watch.
And then perform Weber test. Hold the tuning fork by the handle and strike the fork on the palm of the hand. Place the base of the vibrating fork against the client's skull. The midline of the anterior portion of the frontal bone is used.
Naririnig nyo po ba equally?
Opo.
Or mas malakas sa kabila? Mas
Equal lang po.
Then perform Rene's test.
So today, ma'am, I will be performing Rene's test. So sasabihin niyo po sa akin ng stop pag hindi niyo na po naririnig. Okay ba?
Gently strike the fork on the palm of your hand to set it vibrating. Place the base of the fork on the client's mastoid process.
Stop. Stop.
Note the number of seconds, then immediately move the times of the still vibrating fork on front of the external auditory meatus. It should be 1 to 2 cm from the meatus.
Stop.
Normally, the sound is heard twice as long as air conduction than bone conduction after the bone conduction stops.
Stop.
Document findings in client record. That would be all. Thank you.